1. Hello and welcome to KCS Connects. I'm Jack Miller, one of the directors of Key Clinical Skills, and this is our way of helping connect you with some of the literature that we believe will impact your physiotherapy practice. Now, this edition of KCS Connects has an article. It's a bit of an interesting title, Does Size Matter? And it's an analysis of the effect of lumbar disc herniation size on the success of non-operative treatment. And this was published in the AO Spine Journal in 2020, and the research was done by a group from Massachusetts General Hospital in Boston. Now, just to set the background here, we should appreciate that within back pain, the incidence runs between 13 and 31%. But within that group of individuals with back pain is a subpopulation, those with leg dominant pain, more radicular symptoms. And that can run between 12 and up to 40%. So that lumbar radiculopathy prevalence overall in the general population is just over 2%. And as you can see in that graphic below, it peaks out between that 35 to 55-year-old age group. Now, a spine surgeon's decision about selecting potential candidates for decompression surgery is based on many different factors. Now, one of those traditionally has been the size of the disc herniation relative to the size of the canal. So it's like that gentleman trying to get into that car. It's not just the man size, and it's not just the car size, it's the two together. And that has been traditionally thought to be a predictor of whether or not we should or should not undertake decompression surgery. Now, in this particular study, it was a retrospective analysis of 368 patients with both a clinical as well as radiological evidence of lumbar disc herniation. And they first excluded those individuals with Cauda-Equina syndrome, as well as anyone who was having a progressive neurological deficit. They used an MRI and took an axial image and then measured the anteroposteral diameter of the spinal canal and then the size of the disc herniation, then calculated the relative ratio of the disc herniation to the size of the canal. Now, all these patients were advised to carry on with conservative management, essentially a watchful waiting policy. Now, during that time period, though, 32 of those individuals, 8.7%, did end up undergoing an open discectomy. Why? Well, because they had progressive neurological symptoms. Now, the conservative group were all asked, though, to continue on with non-surgical management, and they were advised to take medication, to have an epidural steroid injection, but also to undertake an active physiotherapy program. And they had to do that for at least 6 weeks. Now, the results of this is that the initial size of the disc herniation relative to the canal basically comes back with an odds ratio of 1. So in other words, 0 predictive value about whether or not the person will or will not require surgical decompression. So we do know that in the past, we have had other studies that have shown that up to 90% of individuals with lumbar disc herniation will resolve with conservative management. And the SPORT trial shows a significant improvement for both physical function, bodily pain, as well as oswestry disability scores, as you can see in the graphic on your right-hand side. So basically, at the end of the day, size of the disc herniation relative to the spinal canal does not have a predictive value. We should no longer be using this as a decision making whether or not the person should be referred on to surgical consultation. If you'd like to learn more about this particular research, come visit us at www.keyclinskills.ca and visit our research review library where we have this and several other studies as well for your benefit. And if you'd like to learn more about how to manage lumbar radiculopathy, again, come see us at www.keyclinskills.ca, where we have our 8-week online Managing Lumbar Radiculopathy course. Thanks for your time.